Namaskar. Good morning, friends, and welcome to 15th session of virtual lecture series on pharmacological and therapeutic effects of top 75 traditional Ayurvedic medicines. Friends, as we are running this virtual series from Canada, so we are running this series with the support of Canada India Foundation, Toronto, Consulate General of India in Toronto, and various Ayurvedic associations and media partners in Europe, UK, Canada, and USA. Today, the topic of our lecture is pharmacological and therapeutic effects of Mahanarayan Tail. Mahanarayan Tail is an oil preparation. It's a traditional Ayurvedic medicine which is widely used in Ayurveda with multiple fold benefits, especially in the management of nervous and musculoskeletal disorders. Traditional Vaidyas use Mahanarayan Tail for external application as well as internally to treat osteoarthritis, hemiplegia, facial palsy, hearing loss, tremors, wasting of muscles, oligospermia, female infertility, headache, psychosis, and various skin disorders. Many Ayurvedic practitioners use Mahanarayan Tail for massage of affected joints with osteoarthritis, but it gives substantial improvement in pain and joint flexibility when taken internally. It reduces joint tenderness and stiffness and improves flexibility of the joints. According to Ayurveda, Vata dosha is responsible for loss of cartilage and wear and tear of cartilage in osteoarthritis. Mahanarayan Tail pacifies Vata and has protective against wear and tear of cartilage, and it improves synovial fluid production in the joints. Mahanarayan Tail is also used as nasya, the nasal instillation therapy. It's a very special procedure in Ayurveda which stimulates the olfactory nerve and limbic system, which in turn stimulates hypothalamus, leading to stimulation of gonadotropin releasing hormone neurons, and finally leading to ovulation. Today, we shall learn from our experts how Ayurvedic method of putting oil in the nose can stimulate ovulation. This is very important. Just by putting nasal drops, the entire body is affected. How it is possible? Today we will learn from our experts. And some Vaidyas also recommend Matra Vasti. It's an enema of Mahanarayan Tail in patients of anal fissure to relieve pain and anal sphincter spasm. Our experts will also share the knowledge about Basti Karam, a special procedure of detoxification which is used as an enema in Ayurveda. Mahanarayan Tail is also used as external application in some skin disorders, including psoriasis. So today, our special guest is Dr. Sundar Sharma, who is currently posted as Deputy Director Technical in Himachal at Directorate of Ayurveda, Shimla. He will enlighten us about the benefits of Mahanarayan Tail. Our special guest, other special guest is Dr. KSR Prasad ji, who is currently posted as Principal of National College of Ayurveda and Hospital, Barwala in Haryana. Dr. Prasad ji has vast experience of Panchkarma. Panchkarma is a special Ayurvedic method of detoxification of the body. There are 5 procedures. So Dr. Prasad ji has written an excellent book on Panchkarma. He will enlighten us about Panchkarma and also how Mahanarayan Tail is used in Panchkarma. Friends, today we have 2 other speakers, Dr. Nitin Juneja, who is currently working as an associate professor at Saraswati College, Hospital and Medical College, Mohali, and Dr. Shaili Chavda, who is currently working as an associate professor at Mai Bhago Ayurvedic Medical College and Hospital, Shri Muktsar Sahib, Punjab. Both experts will enlighten us about the benefit of Mahanarayan Tail, and they will also share their experience. So without wasting further time, I would like to invite Dr. Madan Thangaveluji to moderate the session. Over to Dr. Madan Thangaveluji.
Harishji, namaskar. Thank you again for bringing all of us together on this platform. We've into our 15th session. Our earlier sessions are all archived. You can get them at the Canadian College of Ayurveda and Yoga Facebook page. So please do visit to see the sessions completed before and the formulations we've touched on before. Now, today we are going to learn from our expert speakers here about a very fascinating formulation, Thailam oil-based formulation. We have earlier talked about gritas, we've earlier talked about churnas, and let's find out from our experts on this fascinating formulation. As Harishi says, this formulation is used in many, many ways, and sometimes this is very confusing for the newcomer to Ayurveda. Number one, they are not aware of the formulations. Number two, they're not aware of how we prepare complex formulations and how they have to be prepared with great precision. There is a way in which you make these oils and the way you put the ingredients in, which is never explained in great detail because these are things that happen in the hands of experts. And then comes the place where a Vaidya uses it. Again, a Vaidya, many people don't realize outside India that a Vaidya has to have many, many years of training and also mentoring with the senior Vaidya to learn the skills and to learn the principles and how then to keep learning as they go on in life and they see more and more patients and cases. So we are very, very fortunate to have here with us one of our very respected senior academician and Vaidya, Professor KSR Prasad, joining us from Haryana. Prasadji, namaskar. Thank you so much for being with us today. You can also see we have Nitin joining and also Shili joining us from Punjab. Before we go on to learning from our experts, please take us into something about, very briefly about this fascinating formulation and the kind of surprising results, maybe 1 or 2 examples of surprising results that you have seen in your decades of experience in Ayurveda. Welcome, sir, to the platform. We have many people, young people joining from around the world who will be looking to learning from senior figures like yourself. Thank you, Ji. Prasadji.
Sir, thank you.
The floor is yours. We want particularly to hear from you. You have had many decades of experience in Ayurveda, and we want to hear from you 1 or 2 fascinating, unexpected results you've had with this formulation, with Mahanarayan Tail.
Sure,
to get the ball rolling, and then we'll
Sure.
come back, we'll listen to our experts, and then come back to you for more comments, sir.
Right, sir. First speakers are going to speak, I believe.
No, first we will listen from yourself, sir. Just a few words about this formulation.
Okay, sir. As an opening remarks to that of the Mahanarayan Tail before to go, my association with the Harishi was for a long time. We were trying to make lots of the things, Indo-Canadian forms of the things. Because of the COVID, it has been being delayed but not stopped. We hope within 1 year, we are going to come out with a concrete evidential outputs of this Indo-Canadian Union of the Ayurveda. I am very much thankful for that of the TAM, and I am being the part of the TAM. I welcome all the people here to hear the Mahanarayan Tail formulation, which is clinically useful, and how we have to, or we can make the evidences, and we have the evidences of the Mahanarayan Tail. Every time whenever the Mahanarayan Tail is going to be heard of, it is almost 59 different drugs, different herbs, which are being added. It is a very big formula. To be frank, this much of the big formula, when we are practicing in Ayurveda, how the people were able to make it out and how they were able to prepare it, because it is a tedious process of preparing the Mahanarayan Tail. And that too, this is being indicated as Pana Abhyanjana Vastayaha. When the Pana Abhyanjana Vastayaha, when it is going to be there, the Paka is not supposed to be the Khara. It is supposed to be Dupaka, or to be allowed with the Madhyama Paka level also sometimes.
Prashadji, I'm just going to stop you here briefly. Could you touch on this one point, because you're using a very technical term, the Paga. And,
Paka.
and many people who are listening to you will not understand. It's a very sophisticated term. It is a term for those who are new to this term.
Okay.
I hope we will. Paga is a term that comes from cooking. It is a kitchen term. Pagam is a term that is used when you prepare foods, and when you understand when a food is cooked. If you're cooking pasta, if you're in Italy, you might have heard the phrase al dente. It must feel sharp to the teeth. Similarly, in Indian cooking, we use a term called paga. And pagam in the South, it means when you know your food is prepared, when you know it's ready. So the same thing when preparing Mahanarayan Tail, there is a pagam. And to add confusion to this, there are different types of pagam. So what Dr. Prasad is talking about is pagam, and how you can have different grades of cooked oil. Please, sir.
And here, when we are having this acceptable pakam or the penetrability, it is going to speak about of the tissue levels. If it is of the hard enough, the khara is hard, the soft is the mridu or the mridu paka, which we call, or the medium in betweens. The soft is going to be more tissue penetrable, and here in this Mahanarayan Tail, tissue penetrability was indicated by the Ayurveda. This is the first one. The second, as on today, we are using this particular oil in many of the aspects, especially the Vata Vyathis. To use in Vata Vyathis, we are having the Dashamula in it, that itself is sufficient. Why the rest of the things are being added? Here, when we see the where this Taila is to be used, very specifically, it is going to indicate one Jhacha Abade Putram. It is indicated for the infertility, very specifically a female infertility, not on the male infertility. But I have tried azoospermia and oligospermia, where the sperm count is 0 or minimum. At the time, I used a special technique of the Uttaravasti, directly introducing the Mahanarayan Taila into the epididymis through the urethral orifice, where the medicine is not sent into the bladder as in the Uttaravasti, but I am directly sending it into the epididymis, and thereby the growth of the semen or the seminal vesicles which are going to be get opened, and also they can be made out. This has been given successful inferences and even the evidences. Apart from this, what the people are going to say is, a person who is going to consume Mahanarayan Taila as a panam, internal usage, at bedtime along with the milk, he is going to be get potentiated with that of the productivity of the semen and also even the pushti, Subramhanat. Subramhanat is nourishing very well all the 7 tissue materials, thereby there will be no impairment and he is not going to get the old age also. Apart from this, as there are so many medicines which are there in which treats the exclusively Vata conditions, or either the neuromuscular conditions or the neural conditions or musculoskeletal condition. All these 3 varieties of the conditions are very comfortably being made out. First of all, I want to hear from the other 2 presentators about the nasal presentation of the Mahanarayan Taila as a nasya, how it is going to impact on, and the second, how this Basti, Matra Basti, 30 ml quantity which is being given per rectum administration as the Basti, Matra Basti, how it is going to act on the overall body. These 2 questions are being very typical, and let me hear from the people, then at the end comments, I can offer the answers for these 2.
Prasadji, thank you so much for taking us in so swiftly into the depths of this formulation. In excess of 50 ingredients, the different cooking procedures, how to prepare, and how you have to be careful in how you decide which paga, the stage to which you need to cook the oil to enhance to modify the penetrance of this oil. And that wonderful example you gave of direct administration through the epididymis leading to changes in sperm production. So here's a good example. We are very fortunate to have here with us Dr. Professor Bishnupriya joining us from Shiroda in Goa. She's professor at the Ayurveda College in Shiroda. Bishnupriya ji, namaskar. Bishnupriya ji, in our earlier discussions a few weeks ago, we were discussing Mahanarayan Tailam, and she made a comment about use of Mahanarayan Tailam in nasya, nasal administration. And let us hear from Bishnupriya ji. Bishnupriya ji, namaskar. If Bishnupriya ji is unable to connect with us today, then we will move on to, there is Bishnupriya ji, namaskar.
Yes, sir, namaste.
Namaste ji, thank you so much for joining us. Bishnupriya ji is a professor in one of the Ayurveda colleges in Goa. Shiroda is the name of the location. For those who know Goa, they may not know that perhaps they also know that the 9th World Ayurveda Congress is to be hosted in Goa this year in December. Additionally, a 2nd All India Institute of Ayurveda is also finishing completion, and hopefully the inauguration of this new All India Institute of Ayurveda, the 2nd of these All India Institutes of Ayurveda, will happen also in December. Bishnupriya ji, thank you so much for joining us today. You heard from Dr. Prasad about the magical formulation and also how you can use the Vaidyas skills in this instance to manage infertility in males. Now, in our previous discussions, you mentioned nasya and use of Mahanarayan Tail and nasya. Please tell us, Thank you so much for joining us today from Goa. Namaskar ji.
Sir, I have a short presentations. Let the procedure to finish, then I can join at the end.
Yes, okay. We will wait.
It will be more fine. Yes, sir.
Yes, we will have you afterwards. Thank you again for joining us. We will now move on to our next. We are very fortunate to have so many expert speakers here today. We will move on to our expert today from Himachal Pradesh. If I can, Namaskar ji. Dr. Sundar Sharma is joining us from Himachal Pradesh. Sundar ji, Namaskar ji.
Sir, Namaskar.
आपका कैमरा दिखाई नहीं दे रहा जी.
Sir.
नमस्कार जी.
Sir.
नमस्कार जी, सुंदर जी, नमस्कार. Dr. Sharma is the technical director for the state of Himachal Pradesh. For those who know about Himachal Pradesh, you know where it is, north of India. For those who don't know, Himachal Pradesh is a beautiful state in India, mostly mountainous, adjoining Punjab, Haryana, and a home of many traditions, and also home of many institutes. Very many central government institutes are located in Himachal. Namaskar ji, thank you so much for joining us today from Himachal Pradesh. The one point I want to emphasize is the ease with which we are connecting the world. We are connecting Canada to Himachal Pradesh, to Haryana, to Bombay, and I am today joining you from Austria here in Europe. And we have listeners coming from many other parts of the world. It's a delight to be doing these programs and connecting the world. Namaskar ji, Sundar ji. Very, very happy you are found some time to be here with us. Please tell us what is something about where Ayurveda wants to go and what is in your mind in terms of what is happening in Himachal Pradesh, a very rich state with herbal medicinal plants. Please tell us, sir, about particularly aspects of quality of our formulations and how, whether we are up to the mark, whether much more can be done, and particularly when we come to complex formulations with 50 plus ingredients, what is it that we are missing or what is it that we already have?
Sir, as you have already said that this is a Mahanarayan Tail, particularly we are talking about today, is a magical medicine. And the name itself speaks that Mahanarayan Tail is very useful, not only for preventive disorders, but also for curative disorders. Dr. Harishji also discussed in details the names of diseases that can be managed with the help of this medicine. But in my experience, I have not seen many people using this medicine for treating so many diseases with this medicine. Actually, it contains around 60 herbs, different herbs, having so many properties, and how these properties of individual drugs are useful in different types of diseases. Can we manage with lesser diseases? Different diseases can be managed with lesser number of diseases as we are using in blood products. Then are we using these medicines very genuinely or not? This is the issue. You have asked about the quality control. Quality control is governed by the DNC Act, as you know, by the government of India, and we are trying our best to manage everything as per the guidelines provided by the government of India. We have 3 Ayurvedic manufacturing units, which are also manufacturing this Mahanarayan Tail or Panchguna Tail in one of our pharma units located at Joginder Nagar, Himachal Pradesh, district Mandi. So,
is this Sundarji, this formulation, all the 3 belong to the state government, or are they non-state government manufacturing units?
So this is a classical product that anyone can manufacture throughout India. And
No,
these
the three you mentioned in Himachal.
Yeah. These three are the pharmacies we are having, which are
Government pharmacies.
producing
Government
classical as
pharmacies.
well as proprietary medicines. Yeah.
These are government pharmacies. Otherwise, there are
Yes.
around 800 pharmacies in Himachal.
800 pharmacies.
800.
Thank you,
Sir?
Hariji.
Sir, how many pharmacies are there?
In private sector, around 200 pharmacies total.
200 pharmacies.
Yeah.
So,
Sundarji, thank you so much for joining us today and highlighting that one point about quality. In a few minutes, could you quickly tell us where are the challenges? Because when you have to collect, I'll give you an example. Mahanarayan Tail has in excess of 50 ingredients, and they come from different parts of India. They all have to be gathered together. It is not an easy task.
Yes, sir.
How do you-
Availability of raw herbs definitely is a question today. Moreover, the pharmacies are focused more on financial profits, more other than the quality of drugs that they are manufacturing. So I have seen some of the companies that are using different types of lipid soluble isolates drugs, single drugs, that they are just combining and manufacturing these Mahanarayan Tail, which is not as effective as if we process through the classical method of manufacturing given in our textbooks. So obviously the quality control is compromised at some level. And though in the API, we have got the specifications or the standard testing protocols we have given. So we are trying to keep as much control as possible. We have notified around 18 drug inspector in the state, in our state, which I think is the maximum in the country. And they are taking the samples from the market as well as from the government supplies, and we are all sending it for testing through drug testing lab. We have at Jogendra Mandi, sir.
Sundarji, I had one last question, and I just want to connect with what Harish ji mentioned and what Dr. Prasad mentioned, which is the quality is very important. And it is very clear now that India has taken over leadership of the World Health Organization's Global Center for Traditional Medicine. These traditional formulations will start to become more important. More people will want to use them. They will learn how to use them. And to me, it is unlikely that any other country in the world will be able to make such a complex formulation. I feel it will only be India that can prepare these kind of complex formulations. And it becomes important that we understand how to prepare these things. We will listen from our speakers about the ingredients and the details about how it is used. But I am grateful you have touched that one point on quality. Is there something else you would like to add before we move to our speakers?
So let us first hear to our speakers today, and then we will discuss.
Thank you so much, Sundarji. Now we are grateful that we have senior colleagues as Prasadji and Dr. Sharma joining us. And we look forward to our two presentations today. Now, if you will recollect the format of our presentation, the two speakers are approximately specialists in their areas. One is a person who comes from the domain of Rashasastra and Vaishajikalpana and Dravyaguna, my apologies, and they deal with properties of the plants. So we will listen to that. And then the second aspect is from the domain of Kaya Chikitsa, where how you use these formulations, where do you treat them, what are the indications? So we will learn about those two. So without delaying, let us go to our first speaker, Nitin Juneja. Nitinji, namaskar.
Namaskar, sir.
Namaskar. Thank you so much for joining us today. The floor is yours. We look forward to learning. Before you start talking, there is a question always asked by in our platform. They want to know from our Vaidyas how they came into Ayurveda. What is the motivation to come into Ayurveda? So Nitinji, you will be a role model for many of our young people They will listen to your presentation and they'll be inspired by your talk, but they would also like to know how you came into Ayurveda. What brought you to Ayurveda? So very briefly, and then we listen to your presentation.
Yes, thank you so much. First of all, namaskar everyone. Myself, Dr. Nitin Juneja, and I have done BMS and MD, and I'm working as an associate professor in the Department of Dravya Guna in Saraswati Ayurveda Hospital and Medical College, Gurgaon. It's in Mohali, Punjab. And yes, it's a great question that everybody asks to me as well, that how do we come in this field? And so I would like to say that it is not by chance, it's by choice. Because I've heard more about from childhood. I have heard a lot about the Ayurveda. I've heard a lot about the Ayurvedic medicines, and my grandparents, even my family, my parents, everybody used the Ayurvedic medicines, and have seen them healthy and wealthy as well. And I thought that it has a great exposure if I'll go into this line. And so I choose to move into this line. I remember I was very good in maths. Even I got less marks in science, but still I choose to move into Ayurveda. I have taken the medical stream, and particularly I was in a conscious mind, and I choose the line of Ayurveda, and I'm really very happy. And I always say to my colleagues and my friends who are youngs, even my two nieces, nephews, and in relations also, that if someone wants to grow in their field, and they should definitely choose this field of Ayurveda.
Thank you so much. Now, one last question.
Yes, sir.
Many people here who are joining either here or will be joining us and listening to us on YouTube or other media, they don't know how much study goes into becoming Ayurveda Vaidya. They don't realize that you have already, you studied, I presume, in Punjab, your first degree, and you spent 6.5 years for your first degree, and then another 3 years to do an MD, and these are requirements. People think somehow they outside India, they have the impression Ayurveda is all about oil massages and anybody can do this. No, they don't realize the depth of training that goes into these things. Thank you again, Nitinji, for being here with us today. There'll be many young people who will want to hear from you about how you have understood this formulation. The floor is yours, sir. Thank you.
Yes, thank you so much. Namaskar all, respected all the panelists. And so before wasting any more time, I would like to begin with my presentation. And before beginning with my presentation, yes, I would like to say that sir has said that we have spent approximately 9 to 10 years in the field of Ayurveda, and just for the studying purpose. And so it's a great field, and we have really learned it's not just about the massage, it's not just about the oils, it's all about the we learn about the depth of the this field. And that's the beauty of the field, when we go into the depth and we learn a lot in this field. So please allow me to share the screen.
Yeah, please share.
Yes, sir. 1 second.
Nitinji, are you able to?
Yes, sir. Sir, is it visible?
It's coming through. Yes.
Yes.
Now you're going to have the same problem. I hope not.
I'm just trying. Like, is it okay?
We haven't. If you could go back and go through.
Okay, just let me try once again.
Zoom sometimes has a problem. If you don't follow screen share in a certain sequence, we don't get the presentation mode. Thank you.
Yes. Is it visible now?
If you go to presentation mode. Oh, thank you. Thank you, Nitin. You're all good to go. Thank you.
Okay.
So
yes,
Nitin's details are here for those who want to make contact with Nitin, all the address and email address and telephone number. And for those who don't know, where is Mohali? Mohali is one of those places very close to Himachal Pradesh and almost like a hill station, I would say, almost like a ideal resort. There we are. Thank you.
It's near to Chandigarh also, and
Yes, Chandigarh.
staying in Chandigarh. Okay, so I would like to give a brief introduction about the Mahanarayan Tail, Mahanarayan Oil, because I think we don't have much time to explain about this oil, but in a short period of time, I will try my best to explain as much as possible. And so, as we all know, it's a classical formulation, and which was formulated by our acharyas, and it was mentioned in Sar Sangraha Bhaishya Ratnavali of chapter 26, and later it was also published in the Ayurvedic Formulary of India. And it's a polyherbal traditional Ayurvedic formulation, which is Mahanarayan Tail or oil, and it is a medicated oil known for a great multitude of benefits to the human body. And it is prepared using many medicinal herbs, which we will see in upcoming slides, with sesame oil or the till tail as the base. And a deep oil massage feels heavenly. Again, like it is mainly used for the massages and mainly used for the pain subsiding. So if somebody is regularly using or applying on their body for as a painkiller or massaging their body with this oil, it magnifies the effectiveness of the massage by many folds, and it is marvelous tonic for the nervous system and the musculoskeletal system as well. And okay, in introductory part, the slide has come, and the power of the name. I think name of a person or something else also describes its identity, describes its features. And again, if we talk about this Mahanarayan oil, it has a name Narayan, and this Narayan word, or we can say it is related to our Lord Vishnu, and it says that how that name has been devoted to this Mahanarayan oil, or to this particular oil, or the mixture of the herbs, and we have made the oil. So like Lord Vishnu destroys the evil demons, in the same way it cures the various diseases. So the name has a deep message in it. So from there we have to think over it, that it is really having lots of benefits if we're using it as a medicinal purpose. Okay, and there are many herbs which are present in this oil, or which are really we are using to prepare this oil. We'll start with the like, if we have to make, first of all, we have to make some kind of decoction with these herbs. Like bill, we have ashwagandha, we have brihati, gokshur, shonag. These are all Ayurveda herbs which we have studied in our 5.5-year course, and after that I have done my master's into this herbs, and in that I have studied all the properties of a particular herb. And so here are some herbs which are used in preparation of this Mahanarayan oil, and it's more than 56 herbs. So if the name is Mahanarayan oil and it's killing our diseases, so it's not because of just a single or couple of drugs or herbs. So it has many or plenty of herbs in it. And so like bilva, ashwagandha, brihati, gokshur, shonag, bala, and kantakari, we have punarnava, we have patala. And first of all, we will have to make a decoction from these herbs, and we have to add some kind of water in it, some quantity of water in it, and we have to boil it in say on same flame, and so that we can reduce it on 1/4. But I think that in just 2 to 3 minutes or in 5 minutes time, I won't be able to exactly explain or clearly explain how we can prepare this oil, because it really needs lots of experience while we are preparing oil, because we need to see whether it is prepared properly or whether it is not prepared properly, because we need to keep stirring the oil in between. We have to keep looking on the oil whether it is cooking properly, whether it has burnt, or some herbs which we are pouring into it, like we have to make powder of it, like these herbs which we're making decoction before adding for the adding into the water, and before making a decoction of this, we have to make these herbs into a powder form. So again, how much and how much quantity we need to take, that is also important. And the base things will be and the base oil will be, as I have already told, it's a tail or the sesame oil, and along with that cow's milk or the goat milk, whichever is easily available, we can use that, and the shatavari juice. And shatavari we have to add in this, which is asparagus racemosus. Other than that, we have another herbs which we need to pour in it in the decoction which we have already prepared. It's not like just we are powdering all the drugs and we are just pouring into the water or the oil. We need to make a proper paste of these herbs. When we are making paste of any drug or mixture of drug, we are increasing its potency. We're always increasing its quality and potency. So that's why for this particular kalk or paste, we are using these herbs. And we have some more herbs in this, like rasna, we have ashwagandha, we have nagkesar, we have jatamansi, rock salt. And salt, we have learned that salt is having a minute, salt is always having a penetrating quality, and it takes along with it, like if you're adding into the oil, it is taking oil into the minute channels of our body, minute pores of our body, and showing its effect, and making making the effect of Mahanarayan Tail. We have haldi also in it, and I think everybody has heard that haldi has got the curcumin effect in it. It is also which acts as anti-inflammatory, which acts as antiseptic as well. That is also there in this daru haldi. We have elaichi, we have mustak, we have tej pata, we have bhringraj. Also, we are adding in this preparation. Other than that, we have jivak, like ashtvarg herbs. Jivak, we have rishpak, we have med, mahamed, kakoli, shir kakoli. And other than that, we have approximately vacha, we have punarnava again, kesar, which is again also a main ingredient. So this mixture, when we boil and simmered until the oil remains and filtered to get the Mahanarayan oil. So once we have prepared the oil, the shelf life of the oil will be approximately 3 years. And again, it depends on how we have prepared it, whether we have prepared it correctly, I mean, in a good manner or not. Oh, yes. So the main thing is that effect of Mahanarayan oil, how the effect or the magic of Mahanarayan oil. So the magic is in its herbs actually. So it is a pain reliever oil. So first of all, like already sir has said while introducing about today's topic, and he said that it is being used in many disorders. And I feel that pain is considered as an inevitable part of life. And at some point, everyone has to go through some kind of pains in the life related to the physical pains. like backache, headache, some kind of cramps, spasms. So in that, this oil is very useful if we are doing some kind of massage, proper massage under the supervision of doctors, medical supervisors, if we're doing it regularly. So this is really going to be helpful, and it is really going to be subsiding the pains. It is also helpful in muscle soreness, and how it helps in reducing the muscle soreness, because it has the analgesic properties, it has anti-rheumatic properties, it has anti-inflammatory properties, and so these characteristics makes this oil helps in muscle soreness, helps in reducing the muscle soreness. And if we're reducing the pain, if we are reducing the muscle soreness, it always helps in improves the flexibility and mobility of our joints. How it helps, actually the oil lubricates the muscles and joints, which helps in mobility and flexibility by reducing the inflammation, by reducing the swelling, by reducing the tenderness of the particular joints. If somebody is suffering from arthritis, or somebody is suffering from other kind of pain or joint pain, so it helps in, because pain is always related to the inflammation. So it has the anti-inflammatory effect if somebody that will reduce the pains, and also it will improve the flexibility and mobility. And it is also considered as the stress booster. Why it is so? If we are massaging, keep on massaging and regularly massaging, or using this oil for the therapy, some kind of therapy, so that, because pain is always related to stress. So if we have some kind of stress, or if we have some kind of pain or difficulty in the body, that will again lead to the stress. So by using this oil, if we're reducing the pains in the body, we are definitely relieving the stress from our life as well. And it also increases the blood circulation in the body. Because this oil opens up the locks and loosens the tight muscles, and it also relieves the stiffness and pain. So thereby, because of it increases the blood circulation, and so this is a really good thing which we are getting from the this Mahanarayan oil. So there are a few things like on which we can use this, or few diseases or disorders on which we can use this oil, like facial palsy. We can do some kind of massage on the face, which will helps in which will improve the blood circulation, which will act as anti-inflammatory as well. So it can improve the disorders of the diseases like facial palsy. And it is also helpful in improving the deafness problem. And how it is improving this kind of problems, because it has many ingredients in it, which are really acting on different parts of our body, different systems of our body on the cellular level. So it's not just a painkiller oil, it has many qualities in it. And other than that, sir has already said this part, that it is also helpful in infertility cases, like if you're giving nasya, so it will really helpful in that as well. So it's again for the headache as well, we can use it, because when we are using it for nasya purpose, so we are we can use it, because that will also helpful in for infertility, but it can also reduce our headache as well. So how Narayan Tail is helpful in infertility cases, because it stimulates olfactory nerves and limbic system, which in turn stimulates the hypothalamus, leading to stimulation of gonadotrophin releasing hormone neurons. And in this way, like it has the drugs like Shatavari in it, til tail in it, kesar in it, ashwagandha in it. So these are considered as the balyas, or rejuvenating herbs in it. It contains the rejuvenating herbs as well. So these herbs will helpful in infertility cases as well. So again, in toothache as well, it can be used. If we're doing like gandush, we have a term like covalent gandush in Ayurveda. And if you are doing using with this oil, it can be reduced. Psychosis, it's again related to the stress booster, as I said that. And other than that, kyphotic patients, like for the kyphosis as well, if we are regularly using this oil, that can be helpful in this case also. And so finally, I would like to conclude my presentation. Like it is a well-established classical formulation, which is used in various treatments like fever, arthritis, and it can also be used externally and internally. We can give the matra basti of it, and this tail is also used for mixing with the other compositions, so that drug will increase its potency and therapeutic efficacy as well. Yes, thank you so much.
Nitin ji,
Yes,
thank you so much. You have
thank you, sir.
shown us the complexity of this formulation and the herbs that are used. You touched very nicely on how you prepare the two aspects. One is the decoction that we touched on earlier. The second is the kalka, the paste that's used, and how these are used in a certain way to prepare the oils. We will go on to, so thank you so much for sharing and introducing us to the complexities of this formulation, how it's used. We will move on to Shaili, joining us again from Punjab. Shaili, namaskar ji. Aapka awaaz nahi aa raha ji. You have to unmute, Shaili.
Okay. Namaskar, sir.
Namaskar, Shaili. Thank you
Am I
for
audible?
joining. You're very clear. We can hear you clearly. Thank you for joining us today. We look forward to learning from you about how you use this formulation. Now, before Shaili, before we come to you, one of our attendees has flagged a point here, and I'll raise this also for Dr. Prasad's sake. The point that is flagged here is that Vaishajya Ratnavali talks about it for use only in Kevala Vatam. So this is a very important point. We will come back to this point. Thank you, the person who has raised this, Raghupati Pantulu. Thank you for raising this. We will come back to this point as we come into the question and answer section. The question revolves around rheumatic pains and the difficulty whether tilthailum can be used in rheumatic pains. We will come to this. Shaili, thank you so much for joining us from Punjab. The same question to yourself, very briefly, what brought you into Ayurveda? And why didn't you go off and study modern medicine or homeopathy or something else, or Siddha medicine or something? What brought you into Ayurveda? Is it in your family, or are there some specific examples? Our young listeners would love to know a little more about yourself, where you studied, and why you came into Ayurveda. Thank you, Shaili.
Thank you so much, sir. First of all, I introduce myself. Myself, Dr. Shaili Chabra. I'm BMS MD in Kaya Chikitsa, and I am doing practice in Mai Bhago Ayurvedic College Hospital, Muxar, in Punjab. Actually, I don't know about Ayurveda from childhood, but when I go to teenage, then I get to know that my father suffering from diabetes, and earlier he started taking allopathic medicines, but then he realized that there are so many side effects he found. Then he changed it to Ayurvedic medicine, and after taking Ayurvedic medicines, he started getting results, and I watching him, continuously watching him, that after taking medicines Ayurvedic, his allopathic drugs gets dose get decreased and his symptoms get improved. No doubt, time is taken, not get result in earlier, but after some times he got results, and I found that Ayurveda is got more enthusiasm, more potential in Ayurvedic medicine, and better it's not having side effects. And now he is all absolutely right, all healthy and not taking any medicine. Especially in Ayurveda, we used to advise patients that not only medicine, stick on diet restrictions, because ahar, which is called diet in Ayurveda, we call it ahar. It is the main upstam, main base of Ayurveda. After taking suitable diet as compared to your prakriti, desh, kal, country, means desh means country, and what season is there. We used to advise patients what according to their diet should be there. Like in Punjab, now I am living in Punjab, and here patients are more foodie and take more street food, more spicy food, more fried food. This fried food, which is getting fried in more and more oily substance, which is taken very, this causes improper blood circulation and improper health. So we should advise patient to stop this refined oil, stop this fried food firstly, and take Ayurvedic medicines. And so I realized that Ayurveda is more potential, and I came to Ayurvedic practice. And
Thank
now
you.
thank
Thank you, Shali. It's wonderful to hear that one example you gave of what inspired you to come into Ayurveda. Thank you for being with us. Thank you for sharing that lovely story. And we look forward to your presentation. Thank you,
I
Ji.
also am very grateful to Dr. Harish Verma for giving me this opportunity. And actually, this is my first attempt was on giving presentation on this huge international platform. So I also grateful to all your dignities, all present here. Thank you so much for giving me opportunity. Thank you, sir.
Can share your
Shall I
presentation.
start?
Please,
Start?
Shali. Yes, please.
Okay, sir.
Please share your presentation.
Oh, yes, sir.
I always admire people who can multitask from a mobile phone, share a presentation, and join on a Zoom meeting. Shali, look forward to your presentation.
Is she fine?
This
Are you,
little difficulty. Yes.
Shali, if you have problems, if you send the presentation to one of us, we might be able to
Yes,
share.
I have sent already, Dr.
Okay.
Harish,
Okay,
sir.
then
Yes, yes.
Okay.
stop sharing.
Okay, sir.
Sharing.
Okay, sir. Share.
Okay, and here. Is it fine now?
Wonderful.
Right.
Yeah.
Thank you,
Dr.
Harish.
Shelley, please go ahead.
Yes, sir. Myself, Dr. Shailesh Chabra. Okay. First slide. I'm giving presentation on Mahanarayan Tail, its therapeutic effects. And before starting, second slide,
Yeah.
we must say Om Shri Dhanvantare Dev Namah. And this is about Mahanarayan Tail. It's the next. As Dr. Nitin has said, he explained very well his nice presentation, and he told very much. Mahanarayan Tail is Ayurvedic medicated oil. It is actually polyherbal oil. many ingredients, more than about 99 ingredients are included in it. And it is used in the treatment of many neuromuscular and skeletal-muscular disease, mostly used in arthritis, especially osteoarthritis, because it improves strength of muscles, bone, and joints, and has soothing effect and reduce joint inflammation. And moreover, the sesame oil means til tela is used as a base for making Mahanarayan Tail, which is Ushna and Vata Shamak properties. And it is anti-inflammatory. It reduces joint inflammation and also reduce muscle stiffness, because arthritis patient muscles get stiff, and has got anti-muscle. It reduces muscle stiffness properties, and it is also rasayana, balya, brahaniya properties like energetic and strengthening, which gives strength to the muscles of joint and all muscles patient. It reduces joint inflammation. And it is most ingredients is shatavari, ashwagandha, bala, atibala. It got which is balle, means it is energetic and gives strength to patient. Actually, this oil does not relieve pain instantly when applied externally. Actually, it's a fan. But if patient want to get relief instantly, he should take it orally. When it is taken externally as a massage, pain is get reduced a little slowly. But if it is taken internally, pain get relief within a first week of application. And we used to give patient 5 ml of Mahanarayan Tail with warm water, warm milk. And it gives relief from the joint pain and grating sensation, which he should usually suffer. Patient arthritis patients suffer grating sensation, cramping sensation, prickling sensation. It gets reduced within 7 days with both external treatment and internal treatment, because it reduces joint tenderness, joint stiffness, and it also improves flexibility of the joint. And when we come to drug review, its reference is it is a classical formulation mentioned in the Bhaishajya Ratnavali, which is Vata Vyadhi Rogadhikar, and also mentioned in Bhav Prakasha and Sar Sangrah. And 59 ingredients are there, and Ras Panchak of this oil is Katu Ras, means astringent and Tikat, bitter, Lahu and Ruksha, Ushna Virya with hot potency is there. And it is a Vata Kapha Shamak Doshghanta. And this is reference of Vaishajya Ratnavali. Next slide. And it is herbal oil. These are 59 ingredients mentioned over here, starting from Bil, Ashwagandha, Bhreti, Shavdashta, Gokshur, Shivnak, Patala, Bharibhadram. And these all ingredients make it effective in joint pain, arthritis. And osteoporosis, osteoarthritis, paralysis, Parkinson disease, and Parkinson disease, in which patient get tremor, bradykinesia, and muscle rigidity. And deafness means hearing inability, and infertility, headache, and all Vataj roga, and skin disease. These are the disease which get treated with Mahanarayan Tail. Firstly, we discuss about osteoarthritis, in which there is joint space narrowing and loss of cartilage due to wear and tear of cartilage due to aging and muscle and more use of joints. This is osteoarthritic joint, and this is healthy joint, where more cartilages getting breakdown. It is also called degenerative arthritis, and also there is decrease in synovial fluid.
Shailiji, we have lost your. Harishi, looks like we have lost Shailiji's connection.
Yes, some network problem is there.
No.
Okay.
Now it's
Thank you.
and osteoarthritis we use Mahanarayan Tail, and in Ayurveda what is called responsible for this. And Mahanarayan Tail is best for Vata Shamak. It pacifies Vata dosha, and in because the most ingredients Shatavari, Ashwagandha, Bala, and Ati Bala, these are all having Vata Shamak properties. These possess Dhatu Poshaka, means nourishing properties, and also improve synovial fluid. It is used as local abhyanga massage we use, and then Janu Basti is there, means pulling and holding of herbal medicated oil over knee. Janu is called knee because knee osteoarthritis is most common arthritis present there. As well as we use Matra Basti, little amount of Mahanarayan Tail, and ingredients are being used. 30 ml Matra Basti is used as enema, and it helps to remove vitiated vata from the body. And regular massage, if we do with this oil, it strengthens the muscles and help decreasing joint pain. And it is very helpful in osteoarthritis and sandhi. It is called sandhi vata in Ayurveda. And also next in infertility cases, we use Mahanarayan Tail as a matra basti, as enema. It is used in infertility, and if oligospermia is there, we use Mahanarayan Tail vata basti because it normalize the reproductive tract physiology and pathology, and also treat Vata disorders. We use also use Nasya Karma, transmucosal nasal insufflation in the case of infertility. Batra Basti also balance Apana Vayu and lead to Vata Anuloman and normal Vata functioning and normal extrusion of ovum from follicle and normal functioning of reproductive system. It also stimulates enteric nervous system, which generates stimulatory signal for central nervous system and stimulate hypothalamus for gonadotropin releasing hormone, and also stimulate pituitary gland for the proper normal functioning of FSH, follicle stimulating hormone, and luteinizing hormone secretion. So in this way it works. And also we use, along with Basti, we also use Naste, which as Dr. Nitin also said, it stimulates olfactory nerve and limbic system, which stimulate hypothalamus and also lead to release of gonadotropin releasing hormone, and normal ovulation is there. And nasal therapy means Naste also reach the Shringatak marma and spread through nose, ear, eye, and tongue into head, and eliminate dosha and promote normal physiological functioning of reproductive system. As Mahanarayan Tail contain many Dashmula, Ashwagandha, Agnimanth, turmeric, tagar, neem, cardamom, tulsi, bilva, gokshur, bala. So many ingredients are there, and these some ingredients are helpful in skin infection also, like shatavari and til tela, pacify vata, and also having wound healing properties. Also neem, haridra, tulsi, these are all having wound healing properties. And we use it also uses Mahanarayan Tela in skin infection because also it flush out toxins and detoxification of body. And Shatavari, it's very soothing effect for skin, and it also promote healthy blood circulation, sensory coordination. And with these properties, we also use it in paralysis and also use it in anal fissures because Shatavari, Tiltera, Neem, Tulsi, these are having wound healing properties. And a study was conducted in anal fissure patients, they were treated with Basti, oil enema with Mahanarayan Tail. And after 1 month treatment, their pain and sphincter spasm, it was very reduced effectively. Because saponin rich fraction, which in where in Shatavari, it anti-toxic activity, which cause relaxation of smooth muscle of anal and reduce the spasm. It also has soothing action and lubricant layer. And lubricants means it may act as a barrier over the wound and minimize friction. When patient trying to defecate and pass stool during defecation, it's a its lubricant effect make as a barrier, and also it promote wound healing. So it's being used in anal fissure patient also. And also it has having analgesic and anti-inflammatory effect we use in headache, and if a patient got injury, then also we can use Mahanarayan Tail because turmeric is there and it contains curcumin. It is anti-inflammatory and also it boosts immunity. It is also immunomodulant, and it is so it is natural painkiller because of its anti-arthritic and emolitent properties, and especially bilva is there, and bilva also vatahar and pain relieving analgesic properties. So it is very effective in pain disorders. And also we use Mahanarayan Tail in anxiety patient, insomnia patient. In insomnia patient is there, we use Matra Basti, Nasta and Shirobhyang, Shirodhara, Shirobasti. Shirobhyang means massage food. And Shirobasti we use cooling of medicated oil over head. Shirobasti. And because we have there Shatavari, Ashwagandha and Tagar, which are having anti-stress relieving properties, which calm nervous system. So it relieve anxiety by using Shirobasti and Shirodhara is here. And with all these properties, next this is Shirobasti and next is Shirodhara, which is very calming effect on nervous system and patient get relaxed. And next is on use in paralysis and Parkinson disease and tremor. If a regular massaging of Mahanarayan Oil is there, it heals the bone and also increase blood supply to the surrounding muscles and rejuvenate nerves and provide relief in paralysis and tremor in Parkinson disease. And also we use Shirobhyang, Nastya, Shirodhara, Shirobasti along with Abhyang. We must use Shirobasti and Shirodhara in paralysis and Parkinson disease patient. For 7 to 10 days we should use, and it control Vata, relax the central nervous system. And with the effect of Nastya in Parkinson disease, also Vata get pacified, because all these are Vata Nanatmaj Vyadhya, and we use Mahanarayan Oil in all these disease. And finally, I conclude, after evaluation, it can be concluded Mahanarayan Tail is very effective mode of treatment in various diseases like osteoarthritis, infertility, headache, anxiety, paralysis, Parkinson, deafness, in all these diseases, and it has having without any adverse effect. These are references. Thank you so much.
Shaili, thank you very much.
Actually, I got a little throat irritation, so little bit.
It's the start of it is the start of winter in north of India, I guess, and it's the change of seasons, and
yes,
it's the time when you can get all kinds of upper respiratory tract inflammation and complications. Thank you, Shaili, for joining us today. Most of all, thank you for sharing with our viewers the story of how you came into Ayurveda. And please be with us. We have questions that have come up in the chat box. And I also see Pallaviji has raised a hand. Pallaviji, namaskar.
Thank you, Dr. Madan. I have a question to both the speakers. How to maximize the absorption of Mahanarayan Tail via the skin And can it be given orally as well as local application to reduce pain and inflammation?
Now, Pallavi,
Yes, sir.
would you like this question to Shaili, or to
Yes.
is it open to both?
To both, please.
To both speakers. Nitinji, I think Nitin ji, namaskar. I hope you got the question from.
Yes, sir. Namaskar. Yes, ma'am. Ma'am, can you please repeat the question?
How can you maximize the absorption of Mahanarayan Tail via skin, that is local application? And is it beneficial to give orally, as Dr. Shaili said, with milk and local application,
Water.
both to reduce inflammation and pain?
Yes, ma'am. First of all, like ma'am has already said, it can be given orally. It depends on the disease, like in which disease we are administering this oil. So yes,
For
definitely it can be used internally.
For joint
Yes.
pains, basically, muscular and joint pain.
Yes, for those also, yes, along with the external application.
What would be the dose for Nasya? If you have to give Nasya of Mahanarayan Tail,
Yes, we can pour in the each nostril, 2 to 4 drops in each nostril.
okay. Okay, thank you. Thank you.
Yes, ma'am. Yes, ma'am. And like you ask about the absorption in the skin, and yes, that depends on how we are, how much quantity of the oil we're using for the massage. So it also depends on that. And the
Generally,
way we are massage.
what we do is we first give a little fermentation to that area so that the skin expands and you can apply the oil. So there's better absorption. Or how other techniques? Or you apply the oil to that affected area and then give fermentation. I have even heard that you make urad dal and atta roti, apply little salt, mustard oil, and then place that roti on that affected area.
Yes,
Kind
I
of.
think yes, we do have Panchkarma experts also here, but in the
Yeah.
practice we used to do snehan, like oilation first, and then we used to do the fermentation.
Okay.
Yes,
Well,
yes.
Thank you.
Pallaviji, I think that question, perhaps we should move quickly to Dr. Prasad, because in his introduction, he mentioned about the pagam, which pag to be used. And he mentioned something about how if you select the right pagam, it helps improve absorption. Dr. Prasad, thank you so much. Now, first of all, you've listened to our two reasonably relatively young practitioners, scholars, teachers here. We would like some feedback from yourself, number one. And number two, about Pallavi's specific question. And before we go to your question, Prasadji, I just want to share for our audience here, the part of Punjab that Shaili comes from. It's a very, very historically important part of Punjab. The place that is called and then also the name of the college, Muktar Sahib, Sri Muktsar Sahib is a very important place. And within that is a historic story of Mata Bag Kaur, also known as Mai Bhago. And I think these are stories that are very important for that part of India. There was a big battle there in the 60s, 70s. And these are messages that connect with the kind of battle against diseases that we have today. And there are some things that we need to keep in mind when we go into this whole space. Prasadji? Yes, the questions, we are continuing from where you stopped. Complex formulation, 59 odd herbs, difficulties in how, or the ways in which you prepare the oil, and the quality standards, of course, we heard from Dr. Sharma. And then finally, specifics about usage. Now, this completely, it brings in all the unknowns into questions here, the variables into question. How do we approach this? So Pallaviji asked the question about absorption and then so on and so on.
Sure, sir. First of all, I congratulate the youngsters, Shaili and also Nitin, for their efforts to come across. Failures are the stepping stones for the success. Each and every time we learn something more and more even. Every time we adapt something more. About this Mahanarayan Tail, let me draw your attention towards this 59 drug formulation, which we are going to see. This is actually Narayana Tailam, because the word Narayana Nam Mahacha Tailam. This is Taila is having a gross effectiveness and also gross ingredients. That's why that become Maha and Mahanarayan Taila. This is by name. Number two, this out of these 59 drugs, as on today, Ashtavarga is not available. Stoniya is not available or controversial. Choraka is controversial. Kasturi or Mrugamada, it is not available, the original forms. The non-available medications are the herbs which we are come across. We are putting some of the areas, some of the substitutes. Then the name Mahanarayan Taila, which was attributed by the Vaisheshya Ratnavali and also even the Bhavaprakasha also, has not totally appropriate for the present day. I just want to share a small screen for the understanding. This screen, which shows you there are so many other ingredients which are being available. Can you see the screen? Here, Narayana Taila 1, 2, 3, 4. There are 4 varieties of the Narayana Taila has been had. This third Narayana Taila is mostly mimicking, or it is nearer to that of the our principle Mahanarayan Taila at present what we are using with the 59 drugs. Very specifically, this reference is from the Vaisheshya Ratnavali and Bharata Vaisheshya Ratnakara, which used when we see very specifically it is being indicated for the Vata Vyadhis and infertility and so on. Now, when we are looking these formulations, different formulations which we are come across, the non-available drugs are to be vomited, and we do not know exactly how these vomited drugs are acting in the formulations. Second, when I go through this formulation area and its effect which has been discussed, the first one, Vandhyachanari Labhacheta Putram, very straightforward statementation where the Mahanarayan Taila indication is being used is for the Vandhya and infertility. Apart from that, Dashamula as it is used for all the Vata Vyadhis. And Vapuh Prakarshena Vijayancha Nityam. If it is externally used, it is going to get the strength and immunity is also being told. Tailopasevi Jaraya Bhimukto. When it is being used as a Tailam, then the old aging or aging can be retarded even. Aging is a Vata program and Vata procedure. To Vata to regulate, Mahanarayan Taila can be used anti-aging formula also. Jive Chiram Chapi Bhaveda Yuvaiva Narayana Naipi Subramhanardham. Here, one sentence in between comes is Prapnoti Lakshmi Pramada Priyatam. Very specifically, this is used as a Bajikarana Dravya also. We have to use this Mahanarayan Taila as a Rasayana and Vajikarana areas. Number 2, this particular program of the Narayana Taila with as Pana Abhyanjana Vastayaha. This is a simple word has been said. What does it indicate? This Pana means it is a Snehapana, it is a Nasapana. When we are using as a Rasayana program with the milk at bedtime is commonly being given 1 Karsha Pramana is 12 grams. 12 grams at bedtime with the milk Mahanarayan Tail who consumes, he is going to be achieving the anti-aging effect, Rasayana effect, and Vajikarna effect, aphrodisiac effect. Apart from this, there is a Nasapana. Nasya bit which we are using nasal administration or transnasal administration of the medication. Sorry. This transnasal administration of the Mahanarayan Tail is a Nasapanam. We have to use the maximum dose, not 2 to 4 drops. We have to go the optimum dose of the Nasya administration. Then only we can achieve the requisite effect of for the infertility, which is going to trigger through the nasal administration, very specifically pituitary hypothyroidism gonadotropic axis, which is there. The same axis is being triggered whenever the Sirodhara effect is going to be there. Both effects are going to be there. Here, the Nasya advantage is the nasal area which is having a particular nerve ending openings, it is being moving through the neurolemma, not through the neuro, and in between the cover of the nerve and in between the nerve. There is a passage that goes like in a wick, how the oil is being pulled upside to lit a lamp, the same way the nasal administration of the oil is going to be pulled into the hypothalamic area. When we are using this external area is very specifically, we can just say transcutaneous. As Snehapana is transmetabolic, Nasapana is transnasal, and transcutaneous administration of the medicine, especially the very good question was raised by the Pallavi madam. How to increase the absorbability? Whenever we are using this massage or application, Abhyanga is only an application. There the Mardana, Unmardana, Utpidana, like different strokes which we are adaptive in particular massage system are going for the massage and Abhyanga. Here, any patient before to undertake this Abhyanga, he must be moisturized all over the body. Take a wet towel and wipe all the body area where you are exposing for that of the massage. It is going to increase 12% extra than that of the normal skin. I was looking many of the people before going to that of the massage, they just directly come. I always advise, take a bath and come into the theater. When they take the bath, usually it will be lukewarm water. Thereby, the total body is going to be get moistened, which is going to accept 12% extra. That means totally 18% of the oil is going to be get absorbed. There are studies. You can just see for this. As the external, when we are looking at the transcutaneous, it is once again heat interactive also is going to be there, with heat or without heat. When we are using this only massage, this is otherwise a frictional massage heat which is going to be get generated. This is not totally sufficient to have a penetrability. But whereas when the oil is being heated, the molecules of the fat molecules are going to be broken into the smaller chains. The smaller chains at a particular temperature, they are penetrable transcutaneous. Thereby, a Kativasti or the Januvasti or the etc., which we are using the external vastis are going to be comfortably being absorbed, and they are going to pass their alkaloids through that of the opened porous surface of the skin. The third area is very important is the basti. The Vasti, when we are saying, we have the two varieties of the Vasti, Uttar Vasti and Vasti. Whenever this Vasti is going to be there, this is a transrectal root and the cutaneous root. When these two roots are there, and transmetabolic roots, Nehapana, we have to compare the oral intake and the rectal intake. Oral intake makes a process, went into the process of the digestion and thereby to the liver, from the liver into the circulation. Transrectal administration directly is absorbed and it bypasses the liver and it goes into the circulation. That is the reason why we use a longer fatty chains in the oral oils or oral medications which are being used. And in the rectal, always we are going to use short chains which are broken. The short chains which are broken, how they are being, a beautiful thing, word which we have come across in Ayurveda is the Deepana and the Pachana. The Pachana drugs which are there, they facilitate. Chakrapani very specifically says how this is going to be get absorbed. When I was looking in the physiology book, it is being the enzymes which are secreted in the stomach are going to be get active in the large intestine. You can just go for the Ganang physiology. There are n number of the enzymes which are inactive in the stomach but secreted in the stomach and active in the large intestine. They are responsible for that fat digestion, which is being inserted in a smaller quantity, 30 ml. And it is more time it is going to be therein, and thereby the absorbability is not at all a problem. When we have the transurethral or the Uttaravasti, transurethral, transvaginal, and also we can just say it reaches three areas, either the bladder, testis, and the uterus, all the three areas. Very specifically, many studies are related with that of the infertility are available, anovulation is available, and as a Vata Vyadhi is available. Mahanarayan Tail at a full length, nobody has been utilized as on today. When I see the number of the articles available in the net, the usage and research over the Mahanarayan Tail is very limited to that of the fertility area rather than that of the more distributive area. There was one question being raised about this deafness. In the deafness, how we are going to use it. When I was there in Vardha, Maharashtra, at the time, I have suggested one of the Panchakarma fellow student who was there with from the Shalakya department, ENT department. When he is enthusiastically writing, I said there is a Karnavasti to be made out. What we have used is, we have made a pipe or plastic bottle which is of the 4 inches height, surrounded by the ear, and in that we are going to fill like Kativasti in the Karnavasti. And when it is being done, it is only a pilot cases were done, not totally, and meanwhile the doctor has shifted from the area. A pilot cases when they were studied, there was a much more improvement in the audiometry. When the audiometry improvements are being observed with a limited period, we can understand the long-term procedures can make something more. Once again, I just say there is no classical or evidence-based materials existing either in the net or in the surface about the Mahanarayan Tail greatness to describe. It is everybody's personal opinions and personal experiences. Nobody records. Very unfortunately, in Ayurveda, the recording process of their effectiveness in their clinical practices were absolutely nil, and very few people are doing nowadays. And they are doing for themselves, they doesn't disclose to the others also. If any other questions are there, I can just make it up.
Prasad, thank you.
I just want to conclude it. The Mahanarayana Taila is a Rasayana, it's a Vajikarna, and it is used for the almost all Vyadhis. If suppose you are at the confusion to use which taila to be opted for the disease, you just use the Mahanarayan Tail. Ultimately, you will be getting the result for it. If at all any other questions are there, I'll be obliged.
Sir, thank you so much for elaborating, Prasadji. There is one question that has come up here, and you showed Aushadhi Kosha. You showed
Yes,
some of the different. Is this the question here? Is it available online for all users? Aushadhi Kosha, is that available online?
I think CDOC people are selling it. I think you can. It's a very cheap, even 1,500 rupees. I think
1,500 rupees, and it is
But
available.
only
as
the
a
question
CD?
is, this is compatible with the XP
Okay.
and
So there
7.
are some-
And I don't know whether it is compatible, whether there is a compatible version available for the Windows 10 and 11 or not.
Thank you, sir. Thank you for mentioning. So that was a very important question that you showed the screenshot of Aushadhi Kosha, and people want to learn that. If
you want to see this total, I can make it out even. Shall I demonstrate it? How it works?
We will just quickly, sir, we will take a demonstration, but we want to hear from Sundarji, and I also see Professor Bishnupriya ji has joined us from Sundarji. Namaskar.
Sir, namaskar.
Namaskar ji.
Sir, with your kind permission, I would like to share a few points, please.
Please, sir, please, we are waiting to. But first of all, Surendraji, what did you, for our young presenters, they would like some feedback from yourself, where the presentation's satisfactory, because now Prasadji has shown the different formulations. He said, some of the drugs are missing, some of the plants are missing, and there is a need for possibly refining this formulation. So that is one open question, sir. Number two, feedback for our young presenters, what you heard from. And then we will listen to you, sir, please.
Sir, for our youngsters, I would like to say that they have started their journey, and I wish them all the best. Hope they will do well, very well in future.
I hope they can stay in touch with you and learn from yourself too.
Yeah, sir, definitely. Why not, sir? We will always be in touch, sir.
Thank you.
Now, sir, I would like to share 2 points. What Dr. Prasad has just said. He said medicine absorption through rectum bypasses the liver. This means in case the quality of drug is poor, it is directly going to harm the patient. If the quality of drug is poor and it bypasses the liver, then it directly going to harm the patient, sir. Second thing, sir, I want to know from Dr. Prasad if he can reply. I am talking about transdermic absorption, maybe intercellular or intracellular. Sir, is there any structural difference in the skins of Vata, Pitta or Kapha Prakriti individuals? Because Vata Prakriti patients, I have seen they can get a better absorption of drug in comparison to Kapha Prakriti people, sir.
Thank you. I think this question is on the mind of many other people here, Sundarji. Thank you for raising this question.
Now, sir, a few words about the challenges in production, sir. Again, I am taking your time, sir. With your
no, please. These are all key questions we want to hear from, learn from you too, sir.
Sir, Dr. Prasad has rightly said that all the 59 plants in the Mahanarayan Tail are not available today in quantities sufficient. That means they are being substituted, or they are totally not used in the preparation, sir. Means out of 59, they may be using 40, they may be using 45. Second thing, sir, it is very important because I am talking about evidence-based these problems what we are facing today. Are some species of plants mentioned in the plants? Our texts are available. Same species which are mentioned in the text are available today or not? If not, then we are substituting those species. Those species that we are using now may not be as effective and safe as those mentioned in the classical text, sir. I will give the evidence, sir, just now. Now, third thing is, sir, are we using the same parts of the plants? Means roots or leaves or stems, whatever mentioned in the classical text, are we using exactly the same parts or substituting? Because if you go to market, we are getting everything. We are not getting what we want. Actually, recently, Government of India has issued 2 notifications, sir. One was the matter which came to the newspaper that Giloy, Tinospora cordifolia is harmful, is actually liver damaging our livers. Then Government of India has to notify that we are not talking about the same species which are mentioned in the text. This species which is causing harm to the liver is being substituted and is not mentioned in the classical text. Second notification was about ashwagandha. Actually, the root of ashwagandha is being used in our classical text. But some of the people are now using ashwagandha leaves, which are not mentioned in the classical text. So, efficacy and safety here also comes into question, sir. We have to use exactly the same species, same number of plants, same parts used for getting a quality drug, sir. Now, what was I am talking about? Actually, I have seen in some cases that people procure oil-soluble liquid extracts, maybe of single ingredients or multiple ingredients. They procure and mix in their units and prepare Mahanarayan Tail and send them in the market, which is not as effective. And we are not getting that much result that have been mentioned in our classical texts in books. Now, one thing is more important. Some of the labels on these medicines, this thing is mentioned not for internal, only for external use. Why only for external use? This is also a question, sir. Whereas in our text, it has been indicated both for internal and external use. Then why on the label only for external use? Some of the people may be using mineral oils instead of sesame oil, sir. That is also compromising the quality of drugs, sir. So these were the questions, sir. What have
Sundarji, thank you so much. You have taken us into the heart of the difficulties, especially with complex formulations, which have a large number of ingredients. And Prasadji has told us just a few minutes earlier that some of these plants and ingredients are not available today. Prasadji, the question for you is a continuation. I think Sundarji is challenging us with all these issues, and particularly, basically, he might be telling us that none of the formulations that are available in the market are trustworthy.
Not challenging, sir, but just clearing my concept.
Clearing your concept. Okay, that is that's my interpretation, that this is a difficulty in Ayurveda, particularly when we want to globalize Ayurveda, and particularly when we are talking about such an important formulation with so many valuable opportunities for the future. How do we resolve this tension, sir? Who has the best? I could put this question slightly differently. The formulation was described thousands of years ago. Who today has the best formulation in the market? And from a researcher's point of view, this becomes even more important, because from a researcher, we want to understand the interaction between the complex formulation with different parts of the body, and we want to be able to reproduce some results And if nobody can make a reproducible batch, then we are in a big difficulty.
What Sundarji was speaking is absolutely true from pharmacy point of view. Today's discussion is limited to that of the only Mahanarayana efficacy, thinking that the Mahanarayan Tail, whatever is available as prescribed or labeled for internal usage, when it is being used, how we are getting it. Because if at all we are going to dwell the difficulties of the formulation and difficulties of the preparation and pharmacy problems and issues, that becomes a very big and vast, and where we are not authenticated to comment even. Rather, there are some of the other specialists, those who can. As I say, that there are some of the areas, some pharmacies which are writing for the internal use. Probably we are thinking that they are using the tilatailam or edible oils, and other people may be using the mineral oils or the karapaka, as I said, the burnt process in the process of the preparation of the oil, if it is being burnt or if it is going to be get more hard enough, thereby the absorption is questioned. And as per this absorptions and other things are being there, even Sundar sir was speaking about the issues with reference to that of the ill effects of the matravasti when it is bypassing the liver. Of course, this is one thing which is very specifically is there. And we are unable to make it out. We have to make some of the quality tests. Usually, if in the brudupaka or the soft, when it is going to be, there will be a little moisture. Dipping a small cotton in the oil, which we are using for the internal, that is basti very specifically, or even for the pana. If we are going to lit it, it is going to sparkle and there will be moisture is being witnessed in the wick. If so, then we have to make the patra pakam. After making the patra paka, demoisturizing is done. After demoisturizing, we are going to administer it for the basti or even for the internal usage. Internal usage, even the moisture is there, we can ignore as it is going through the digestive procedure. But for the basti and uttara basti, demoisturization through the patra paka is the mandate. After doing the patra paka, if at all we are going to administer it, then there will be no sort of the complications. Most of the time, this patra paka even makes the longer fatty chains into the shorter because of the heating procedures.
So thank you very much. You have touched on some of the subtleties which have to be respected. And you're also reinforcing Sundarji's comment that we need more discussion here. We need to go into the specific details. And from the global perspective, these subtleties have to be understood. And I think it will be best understood in India because there are more scholars who appreciate these fine details. And I think it calls for more discussion. Thank you for highlighting those points, sir. We have Vishnupriyaji Mohantyji joining. Vishnupriyaji, namaskar. I hope you followed us while you were preparing things. And initially, quick comments to our two young presenters, Nitinji and Shaili. Some feedback about their presentation. And also, we want to hear from you. You promised to tell us a little bit about how these formulations can be used, particularly through the nasal route, Nasya. Thank you, Ji. Your presentation is on the screen. Thank you.
Yeah, namaste. My regards to all of you. Now, 2 points are expected from me. Number one, it's pharmacological actions, especially for the treatment related to infertility and how the Nasya works. So, now we are giving an extra that is to comment on the presentations. They are actually very good in their presentations, especially at their point of experiences. Now if we are acknowledged as experts, So we need to work what is the bonding points are going on discussions. Because it's not a individual products problems, it's a problem related to many such formulations, and the claim or blame is coming to the whole Ayurveda fraternity. So coming to my point of view, when we are discussing about the Mahanarayan Tail, why I answered in the previous discussions that we should encourage the Nasya therapy, because in our clinical practice we are watching that more a time people are habituated to take such all variety of drastic purgatives, but classics speaks us using the Nasya, especially Ghrita has given there. So Nasya could be a best medicines for making the laxity properties. So there is a big connectivity in between Nasya and its impact on in our language. That is how the gastric motility, how the intestinal motility can be accelerated, and those connections, that those bridge need to explore. So it is when we are thinking that the gut microbiomes are there and that have a good amount of relationship to all these complex diseases what we know in our society, that is in terms of cystic fibrosis, or it could be a simple obesity. There might be the loose motions because of irritable bowel syndromes, and there is we feel the necessity of antibiotic applications, and antibiotic have a very strong role to make cancerous stage. So those all microbiomes are nourished through the Basti applications too, and pre-diabetic conditions that comes because when the diversity in the microbiome.
We have lost, we have lost Vishnu Priyaji. There's some network. This time of the year in India, there are rains. And from what I know, it's very likely there are heavy rains there in Goa from where Vishnu Priyaji is joining. Apologies for this. In some of our earlier discussions with Vishnu Priyaji, we had discussed a little bit about the way in which procedure like Nasya can help individuals to get such fantastic treatment responses. I quickly share this one image here, which you might be able to see now. This is just to show where the place where Vishnu Priyaji might have connected with us. And just to say that this is approximately the anatomy that most people understand. When you do Nasya, it is this part of the anatomy where you're applying all these oils. And you can see these free nerve endings here. They're very important for conveying signals up into parts of the brain. And if you go further into, look at it in close detail, you will see the proximity, how close those interactions are between the pituitary and inputs that come from the free neurons here, and how you can actually apply these complex oils down in this part, the nasal root, and you can bring about reduction in all kinds of complications in this part of the brain, in the pituitary. And from the pituitary, you can go to the hypothalamus and then go into the adrenal axis and the HPA axis we are all aware of. So some of these complex formulations have a big role. The second one is the skin. We heard a little bit about the skin. The skin is a very complex tissue, a very complex sensory organ too. And you can see here in this schematic the kind of nerve endings that are available there. And anything that is applied to this part of the anatomy can get absorbed, can bring about very complex changes within the body. The body is a non-linear responding system, and you can get non-linear responses. Dr. Sharma's question whether the skin is different between Vata, Pitta, and Kapha individuals, there might be some differences here which need to be investigated. And I leave this here because we are running short of time, but there is a lot that is being learned today about the complex biochemistry, the interaction between the host and the microbes that reside in this part of the body, and how there is a crosstalk between the microbes and the host and the biochemistry, resulting in production of very valuable chemicals here, serotonin, leading from tryptophan, or a slightly different part of the pathway that leads to pro-inflammatory chemicals. And if there is dysbiosis in the nose, you can lead to all kinds of complications. Vishnu Priyaji is here. Vishnu Priyaji, we lost you in between. I don't know, Harishji, how are we for time? Will we have a few more minutes?
Yeah, we can have 2-3 minutes.
Thank you, Vishnu Priyaji. We will come to your point on Nasya as therapeutic intervention. And we
Is my slides are visible,
yes,
sir?
very clear. We don't know what happened earlier. We lost you, but
Yes, sir. Yes, sir. This is the reference how classes teaches us that the head itself is a site, how it works on the whole system, like sun. So Suryamiva Gavastasya Sangsrita. So even though we are introducing the medicines here and it works in the whole, and both the way, not only through the basti, it also works through the Pratimarsanasya. And that's why I like to introduce that the R&D of the Siddhanta concepts or the slokas written in the Samhitas yet need to recover and explore. And the pathway is here, that how the body itself, that system itself to understand it is written in terms of say dosa gati. The dosa gatis are there, and gati through which pathway, that roga margas are there, and they travel through those chain of phospholipids. So even though we are thinking that we are giving the medicine in the local area, but it is affecting to the whole body. So those all channels to be clear. So it's in terms of matra vasti we are giving, but it works through all these multiple way. And then it can be very easy to understand the pharmacological actions of our Ayurvedic medicines. It's a mathematical calculation I give him. That's how from one system, that's Anabasrotas, through the liquid media, it disperses the qualities of the medicines to multiple systems. So it is not related to just digestion. It is also related to all those controls of the fluids in the whole body. It's related to the movements of the dosage, or what we say in terms of the metabolic controls, the absorption, the speed of absorptions, the immunity, the defense systems all works. Simply if the water amount will be reduces, those all can be controlled. So we learn that way, that Kleida itself is a biggest pathology, or reducing that Kleida could be a biggest treatments there. That's why it is written Sankepata Kriya Yoga Nidanam Parivarjanams. So coming to the chapters, that is a Grahani Dosa Adhyaya. So actually that is a Charak Samhita Chikitsa 15th. We concise those concepts of metabolisms impacting to the whole systems from the Grani, that is Sasti Pitta Dhara Kala. So translating into the Spur syndromes, that become a big block to the understandings. So it's the whole way the Basti works And therefore, the dhatu posana is possible from one medicine. It was a point of discussions. We apply the tender brinjal to be fried by the Mahanarayan Tail, and then even sometimes we use simple castor oil also in place because it is cost effective. So to be fried with the either Mahanarayan Tail or the Eranda Tail, and to be given to the arthritic patients. So the next one, what I like to say, that hardly we understood that whole nonlinear systems, each thing is interconnected. So those all concepts of understandings to be connected, that how that things become complex and could be simple, very simple way that things can be understood. And being we are depending upon their procedures of investigations. So sometimes linking there we loses our points. So I used to say that we loses our concept in the debatic understandings. So we need to see how the things is going on and what are the things coming out, how their quality. So internal assessments depending upon the things coming out, either it could be the urine or the sputum itself or the stool too. So those all are the way to screen or visualize the internal systems. So we all know that there is a constant flow of body tissue within, so which is written in the Santatya Bhuji Dhatunam Parivrittasya Chakravat. So now something has taken through the oral route, but it just not mathematically go from the annabas srotas then to the liver for the detoxifications, what is written in the other sister sciences. So it is from the oral route immediately could be connected as the Nyaya concepts are there. It is not a Khira the Nyaya only. It could be a Khalekapatra Nyaya. It could be the Krama Parinama Paksha. So these all simultaneously to be implemented. So when we'll able to implement all those Nyaya concepts simultaneously, then all answers easily could be perceived. So this is the Sabda Archya Jalasantanavat. So when I am thinking about the observations of Mahanarayan Tail, so we have to implement these three way of observations, whether it is a Sabda Santanavat, Archi Santanavat, or Jala Santanavat. So Sabda Santanavat, what I am thinking about the nasopharyngeal route. So nasopharyngeal associated lymphatic tissue that it cells actually it's a variety of nasal microbiota. So it protects from all the viral entry. So we can think about that way. There's a khale kapota nyaya. So which khala, which kapoto is resembles, and that way the nutrition or the observations goes on. So that might be a hardship to speak that Ayurveda pharmacology yet need to unfold. And Nasya revive the all the nerve pathway or the relative connectivity has disturbed, because we hardly say it's a oil media. That oil media can only enter into the brain or blood brain barriers. So that way it works. And when we are thinking about the basti, how it controls on the microbiomes, and that microbiomes once activated at one site, that will also pass those messages simultaneously to the all other microbiomes present in the body. That's why it's not necessary to interpret that it is a different compartment like a train. And therefore, as we know, the plants become instinct, the animal become instinct. So microbiomes also become instinct. Therefore, we need a symbiotic process there with a diverse microbiota. The dysbiosis can bring the Vaishyamata, bring many imbalance in the systems, and the diversity symbolized here. Vaishyamya. So our Shastra teaches us Katham Sarira Dhatunam Vaishyamyam na Bhavetiti. So Vaishyamyata is the definition of health. We always impose the Swasthar health definitions that to bringing everything to the normalcy. But Shastra is speaking something else. So very precisely speak about the use of Mahanarayan Tail in terms of Nasya. And the questions are also raised there about the dose, etc. Dose and the durations or the application even completely left in our hand, exactly which area we are belongs to, and what is the sensitivity of the patient itself. If the patient have never experienced to use the oil in the nose, even one drop can be painful. So we have to practice those people's through a gradual dose itself. And that's the way we know that Sukra Dhatu. According to Ayurveda, Sukra Dhatu Prananam Jivanam sa Garbhotpadascha Karmanam Dhatunam Karmasavidu. So Sukra Dhatu is responsible for Garbhotpadana. And that moment we kill the Ayurveda actually. Why? Because Garbha Utpadana is the supreme actions, or when we are interpreting about the Sthanika Sukra. Now, Sarvadahika Sukra need to define. The Sarvadahika Sukra could be understood in terms of the Utpatti itself. So, ACE1 inhibitors, generating the ACE2 inhibitors, that takes place in the nasal microbiota, that levels itself. So, when that activation comes, then all vital organs where the ACE2 inhibitors are present, that gets stimulated. It means just by putting Pratimasanasya, we are accelerating the whole system, the whole body, the whole vital organs, and that actually has understood very peak periods of COVID second waves. So those are there in our Samhita, but that connectivity is needed. And whenever we are giving the Pratimasanasya, say we need to understand that a simple inflammation can be a biggest causes of hypertension. So a simple inflammation, where it is, that inflammation, if it is there in the brain, in the microglia of the cardiorespiratory systems, so that initial events can connect to the further events of sympathetic uncontrols or the parasympathetic reductions, which will again roll on the immunity of the body itself. And we look into the patient when the neuroinflammation has already established. That's why we sometimes unable to connect those things are related to the simple steps of Pratimasanasya itself. And now we can also connect to the renin-angiotensin pathway. And we can also connect to the PNEI axis. So the psychoneuro endocrine immunological axis. Now they understood those things. That's why now the new biochemistry is ready to understand that these things are going on and these things are effective. So Ayurveda teaches us that is Urdhamulam Adhusakams. So it's a reverse way that things works in our systems. And those are reverse way. It's actually clear in the that is in the Siddhi Sthana, 9th Trimarmiya Siddhi. So there it is clear that how it is act in a reverse way. So by giving the nasya, it can affect to the whole body. So these all things are well available in the through the Google itself.
Vishnupriyaji, thank you so much. We are running a little beyond our time. But
yes. I have come to the end, sir. Actually,
yeah.
So it's all the way we have to rejuvenate the Ayurveda. Then it become very easy to understand those questions. Thank you so much.
Please, could we have your last slide, because there will be many people who would like to make
yes, sir. Yes,
contact with you. There it is. For those who Vishnupriyaji is very special to us, because every time she is with us, we get to learn so much. The concept she presented today about Kleda is very, very important for understanding so many diseases. The point raised here about non-linear systems, I don't know, and all the important pages, references that she's given us. Vishnupriyaji, what we will do, we will come together with all the scholars here and people who want to join. We will have a very special and continued series of discussions on all those key points that you have raised with us today, particularly non-linearity in the human systems. I want to thank, before I hand the floor back to Pallaviji, I want to quickly say thank you to all the people who have put in questions in the chat box here. Dr. Hema Malini from Chennai. Hema, thank you. Rita Shahji, how to use deafness, how to use Mahanarayan Tail in deafness. I think there are many points from Vishnupriyaji's comments that we need to understand. Raghupati Pantulu, thank you so much for raising your questions. I've put my contact details in the chat box. Please connect and let us chat about this afterwards. So thanks to all who have raised questions. Thanks to, very quickly, to Surendraji, Sharmaji, Bahut Bahut Dhanyawad ji, Shali, Ji, thank you so much. Coming from that historic land of and the town of Punjab, where many exciting things happen. KSR Prasad ji, thank you so much, sir, for being with us. Thank you for touching on some of the key points. And Vishnupriya ji, thank you so much for joining. But we will come back again because you are only taking us, showing us the direction for much more detailed analysis that we need to do. Thank you. Thanks to all for joining us today and initiating this wonderful discussion. As Harish Verma always says, these are only tasters. They are just meant to show you a way towards how effective Ayurveda can be, how effective the traditional Ayurvedic preparations, traditional Ayurvedic medicines can be. Yes, there are challenges, but if we know what those difficulties are, we will be able to find answers. Good night.
Good night.
All yours.
Good night.
Thank you, Dr. Madan. In fact, there was such a pouring of knowledge from experts. It is too much of assimilation in such a short time. But it has been a wonderful session, and I really thank everybody, especially seeking blessings from Lord Dhanvantari. Special thanks to our guest, Professor KSR Prasad, Vishnu Priya Mohanty, and Dr. Sundar Sharma for taking a valuable time out. It has been wonderful. Dr. Vishnu Priya is from Shiroda. It is our a very famous Devsthan is there, Kamakshi. We go there every year. So nice to see you from there. And I come back to our expert speakers, Dr. Nitin and Dr. Shaili, a wonderful presentation, very simple and quick. Thank you very much. My special thanks to Canada India Foundation, Consulate General of India, Toronto, Canadian College of Ayurveda and Yoga, and thanks to CAPA. My sincere thanks to all the collaborators, European Ayurvedic Association, Association of Ayurvedic Academy, Ayurvedic Union of Midwest, US, American Association of Ayurvedic Professionals, and my special thanks to Georgia Bhalla. Dr. Madan mentioned about how beautifully everybody is connected. So thanks to Tathastu, Y Media, Pravasi Media for supporting these webinars. And my special thanks to Dr. Harish ji for connecting all of us on this dais, and Dr. Madan ji for making this such an interesting interactive session. Thanks to the viewers, and thanks to our family for sparing us on a Sunday evening. And thank you all. Next week, we will be listening on Mahatikta Gruth. Gruth is ghee. So it's again a very interesting topic. It will be on 27th of November. And with this, I wish you all a very happy week ahead. Thank you and pranam to all. Thank you.
Thank you so much, ma'am.